You will be admitted to the hospital either the day before or the day of your surgery. You will need to bring your health card, your hospital card, and information about any other healthcare insurance you may have. Due to uncontrollable circumstances, there is a small chance that your surgery may be delayed. If this should occur, we ask for your patience and understanding. While in the hospital, it is reassuring to know that you have a team of experts. Your primary team includes a surgeon, an anesthetist, a nurse practitioner, registered nurses, a physiotherapist, pharmacist, and clinical assistants. Nurse practitioners work with the surgeons to provide care, and you may not see your surgeon every day. Other healthcare professionals that may be involved in your care include occupational therapists, dietitians, social workers, chaplains, and speech-language pathologists. You will need to bring some personal items with you when you come to the hospital. When you pack, remember to include all the medications you are currently taking in their original containers, a front-opening robe, comfortable shoes or slippers with good support, and all your toiletries, including a toothbrush, toothpaste, hairbrush, deodorant, shaving equipment for men, and a box of tissues. Women should bring a loose, comfortable bra. You will also need appropriate clothes and footwear for the day of your discharge. Preparing for surgery begins with a preoperative checkup, including routine blood work, a chest x-ray, and an electrocardiogram or ECG. Depending on your hospital, this may take place after you have been admitted or up to 2 weeks beforehand. A member of the surgical team will review the type of surgery you are having and discuss your medical history. In addition to your daily activities, you will probably be asked about your diet and any special food requirements or restrictions you may have.
Hi, my name is Diem Dao. I'm a pharmacist working on cardiovascular surgery. I'll be looking after you after you had your surgery. I'm here to tell you things you need to do before you come for your surgery. First of all, it will be very important that you bring in all your medications, the actual bottles. I'm not just talking about the medications that have been prescribed by your doctor, but also the over-the-counter the products that you take without any prescriptions, and also the herbal products. All of them might interfere with your treatment during surgery, and also they might interfere with your treatments that you might receive after surgery. So it'll be very important that you bring them all so we can know them. If you're wondering about if you should take certain products before, then you can always ask your nurse, but this will be communicated with you before you come into for surgery. Your medications might change after surgery, don't worry about them. Certain products might be safe to restart and certain product might change, and this we'll try to explain to you as best as we can. If you feel anxious about your surgery, please feel free to ask for something to help you relax. And of course, if your family and yourself have any questions regarding your care, please feel free to ask those questions to us. That's why we're here for. If you have concerns, or if you're not sure if you're going to be able to pay for all your medications when you go home, then please feel free to communicate that to us so we can work with you with the help of our social worker to find you some kind of coverage and to help you to cover for those costs when you go home.
Hi, my name is Marnee Wilson. I'm one of the nurse practitioners in cardiac surgery here at St. Michael's Hospital. We work collaboratively with the surgeons and the rest of the healthcare team to manage your care while you're here in the hospital. As nurse practitioners, one of us will be involved in your care. So what that means to you is that you will see us on a daily basis. One of us will come in and assess you in the morning, do a physical exam, make sure that you're doing fine. We will write orders for whatever medications and tests that you need to have, interpret those and help to develop a plan of care. We work directly with you, your family, and the rest of the healthcare team to facilitate a speedy recovery.
It's best that personal valuables such as dentures, wallets, and jewelry be taken home by family members, as the hospital cannot assume responsibility for the loss of such items. However, you may want to arrange with someone to bring money for you to cover the charges on the television and the telephone in your room. Ask a member of the healthcare team for details.
Okay. Mentally, I just prepared myself for the fact that there was going to be an open heart surgery, and from all I'd heard from friends who'd had it done and various public figures, under today's techniques, it was a nothing procedure. So I was prepared for an easy time, and from what I understand, my open heart surgery went extremely well. There were no problems whatsoever.
Patients are strongly advised to stop smoking. Smoking produces increased secretions and makes a patient's job harder early after surgery in clearing these secretions and coughing. So this really has to be a lifetime commitment once you've had this operation. Prior to your surgery, you will meet your anesthetist. You'll be examined and asked questions about your medications, allergies, and previous surgeries. Other preparations for heart surgery will include a shower with disinfectant soap and fasting from midnight the night before your surgery. However, in the morning, your nurse may give you your medication, which you can take with a sip of water. Just before your surgery, your eyeglasses and dentures will be removed and should be held for safekeeping with your family. You'll then be taken to the operating room. If friends or families want to wait, they will be directed to the waiting area.
Hi, my name is Patrick, and I'm one of the cardiovascular intensive care nurses here at St. Michael's Hospital. What I'm here to talk to you about is your stay here in the intensive care unit. Over usually a normal period is about 24 hours. Just to let you know before I go into more in-depth detail with respect to your stay in here, visiting hours here are a little bit different than visiting on the floor. We run our visiting hours anywhere between midnight until 7 in the morning, and then starting again after 8 o'clock until 7 o'clock in the evening. The only 2 hours that we don't allow any family visitors or any phone calls are between 7 and 8 in the morning and 7 and 8 at night, and that is the change of shift. We only allow the immediate family and only 2 at a time, and for a short, brief period of time in that. Anyway, once you come back from the OR, you'll arrive here in the intensive care unit. You may not be in this particular room, but you might be in another spot or another section of the intensive care unit. We have 13 beds in here that we operate at present in that. As part of the setup here in the intensive care unit, you'll be hooked up to a monitor, and as part of the monitoring devices here, this machine monitors your heart rate, your blood pressure, another line or waveform we call the pulmonary artery pressure, your oxygenation. As part of the setup here in the intensive care unit, you'll be hooked up to a ventilator. That is what we call the breathing machine. And as part of that, there'll be a tube here that runs to the breathing tube that is down your throat, and that. These things you will not be aware of initially when you come because you'll still be under a general anesthetic. You'll have several IVs. One IV will be in your right arm, another one will be in your left arm, and then you'll have another special IV located in your neck. I know these may sound a little ominous to you, but it is part of the monitoring after having this kind of cardiac surgery. 2 other things that you'll be hooked up to. One is the chest tube, and that is this device here that helps to drain blood out of your chest cavity. That is the cavity that surrounds your heart, as well as the pleural space, and those are the 2 spaces on either side of the heart where your lungs sit in that. So you'll be hooked up to this. And the last thing that you'll have inside is what is known as a Foley catheter. And that's this little tubing here, and that's to drain urine from your bladder. And all of these devices will be taken out within usually the 24 hours. Some of them here in the intensive care unit we will take out, and some once you go upstairs to 7C, the Cardinal Cardo floor, for your recuperation. Now, a couple of things that we always like to talk about here in the intensive care unit for all patients, and that is the breathing tube. A lot of patients are very frightened by the breathing tube, and that's okay. When you start to waken up, you have a foreign object that is down your throat, and that's scary for anybody. So what we do is, as you're starting to waken up in that, where you're doing more of the breathing, and the breathing machine that I pointed out earlier is doing less of the work, and you start to come around, we will take that tube out. We usually try to take it out 4 to 6 hours. Now, in some cases, when patients are waking up, they wake up a little restless, a little bit agitated, and that puts a little bit more strain on the heart. So what you might find, as the patient, you won't know this, but your families will, that we've had to put you back to sleep, and then we'll start and try this process again a couple of hours later, and that's very normal. So when the nurse says to you, as you're starting to waken up, are you having pain or discomfort? What we like to see, even though you've got that breathing tube in there, is a nodding of the head, yes, because we want to make you comfortable. And at the same time, we also want you to take a good deep breath. The more deep breaths that you can take, the less time you need to have the breathing tube in, and we'll eventually get that tube out. And as I said, we try to do it within 4 to 6 hours of your arrival here in the intensive care unit.
Hi, my name is Clea. I'm one of the nurses here on the recovery ward. Here on the recovery ward, the nurses will be looking after you 24 hours a day, 7 days a week. We work alongside the surgeons, nurse practitioners, clinical assistants, and all the other members of the allied healthcare team. Here on the recovery ward, we use a pain scale from 0 to 10. 0 being no pain, 10 being the worst pain you've ever had. We like to keep your pain level below a 2. So if your pain level reaches a 2 or above, please inform your nurse as soon as possible so that he or she can bring something for you to relieve your pain.
When you leave intensive care, you'll be moved to a post-operative ward where you will continue your recovery and rehabilitation until you are discharged. You will still be receiving oxygen, and you will still have an IV and a bladder catheter. You will also be put on telemetry, a portable monitoring system which allows nursing staff to monitor your heart rate and rhythm. The healthcare team will also continue to monitor your temperature, pulse, blood pressure, and breathing on a regular basis. Depending on your medical condition, blood tests, chest x-rays, and ECGs will be done at varying intervals as necessary. The nursing staff will check your incisions and your dressings daily and cleanse as necessary. As soon as the incisions are dry, they will be left open to the air. You can expect some redness, swelling, oozing, and bruising. These changes are normal. After heart surgery, many patients report the sensation of their heart pounding. This is common. Some other common effects of surgery include a low-grade fever, sweating, nausea, and an irregular heartbeat, known as atrial fibrillation. This will be treated with heart medications and, in some cases, blood thinners. Soreness around the incision and some stiffness and aching around your back, arms, neck, and shoulders may be expected. Remember to ask for pain medication if you feel uncomfortable. External pacer wires will be placed in your chest during surgery. These may be required to pace your heart, but they will be removed prior to your discharge. A lack of appetite is common after surgery. As part of your routine, you will be weighed every day. Don't be surprised that despite not eating, you will have gained weight. This is a temporary condition, a result of your body retaining fluid after surgery. The healthcare team will give you diuretics to get rid of the excess fluid.
Hi, I'm Vincent Lo. I'm a physiotherapist. You'll be working with a physiotherapist after your operation to work on breathing exercises and mobility. Once you're more independent, you'll start a walking program, and it'll be important for you to get out of bed to prevent complications like pneumonia or blood clots in the legs. Is important for circulation and to build up your exercise tolerance for when you go home. A physiotherapist will help you with breathing exercises to help increase the air into your lungs. We'll also ask you to splint your incision by supporting your chest when you cough. That helps with the pain. And it's very important for you to discuss how much pain you're having with your nurse so that they can give you the proper amount of medication so that you can be comfortable.
I'm one of the dietitians in the heart program. I may or may not be involved in your care after surgery. The nurses are the ones that are responsible for progressing you from a fluid diet to regular food, at which point you would receive a cardiac high-fiber diet, which involves foods that are low in fat, low in salt, and higher in fiber. If you have other medical conditions that require special diets, such as diabetes, then those diets can be provided for you. If at any time during your stay at St. Michael's you have any questions regarding your diet, or even for information for when you go home about your diet, you are more than welcome to contact one of your healthcare team members, and they can be sure to contact myself, and I will be more than happy to come by and speak with you about any questions that you may have. On the day of your discharge, you will be given a folder of information, including a handout on heart-healthy eating, and it would outline healthy food choices, healthy modes of preparation for food, and other resources available to you either on the internet or telephone numbers that you can call for more information as well.
I want you to know there are a few things that you need to know before surgery. The first thing is, by the time you get home, you will be up and around and able to care for yourself, walking up and down the hall, in and out, getting in and out of bed on your own. But you still will feel pretty lousy. You'll be tired, you won't have much energy, and you won't have much of an appetite. so you'll need help. The things that you'll need help with are meal preparation and light housework. Some people have family members that are ready to help, and that's a great thing. If you don't have family members that are readily available to help you, you need to make other arrangements so that you will have good, wholesome meals when you get home and somebody to help you out with the light housework once you get there. If all goes perfectly in your recovery, you will go home 4 to 5 days after your heart surgery. Fairly commonly, though, patients do experience some things that tend to slow their recovery up. One of those is an irregular heart rhythm. Almost 40% of our patients do experience irregular heart rhythm from time to time after heart surgery. This is easily managed with medications, but sometimes takes a little bit of extra time and may slow your recovery down.
My name is Renate. I'm one of the social workers in the Heart and Vascular program. The waiting time before surgery can be quite difficult, as it is with most people. Besides looking forward to this important date on your calendar, you may have, over the last weeks or months, been hospitalized. You might have been told for the first time that you have a heart diagnosis. Whether you are dealing with a new diagnosis or a change in a long-standing heart condition, we know these changes bring a lot of social, emotional upheaval and disruption in your home and your work. This waiting period, however stressful, gives you 1, time, and 2, opportunities to look at the kinds of adjustments you'll be making ahead. We encourage you to plan ahead now as much as possible. It'll give you many more options to fall back on. Talk over with your support network of family, friends, and neighbors who might be available when you come home. In the initial period, you might feel more comfortable having a family member or a friend stay with you. If you yourself are a primary caregiver for a loved one, please let us know as early as possible so that we can discuss your care plan and point you in the right direction for available useful community resources. Addressing as many of these questions as possible before your surgery will give you and your loved ones the added peace of mind you need as you journey through your heart surgery experience.
Thank you for taking the time to watch.